The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody. Welcome to Asia's Health with yours truly, Dr. Tom Roselle. And I got a whole bunch of stuff for you today, but we're going to be talking about your gut, your intestinal tract. And we're going to be talking about it to distinguish different types of things that can come about. But, you go to the doctor and say, well, I've had a bad gut. I have cramping. I have this. I can't do this. I have this. And he says, well, you have constipation, you have diarrhea. But more importantly, then they say, well, it's an irritable bowel syndrome, and some people have it, and you're just kind of stuck. And then there comes the stack of medications, all kinds of stuff to, optimize your bowel movements, your evacuation process, if you will. But most people think of irritable bowel as diarrhea only. And I want to talk to you about what it really can be. And it's often just simply constipation. We've kind of talked about that for a period of time, but I want you to know the effect that it has. And the large intestine starts from the lower right-hand side of your body, comes all the way up, and then transverses across this way and drops down. And it can be miserable if that thing's not working. But at the end of the day, the symptoms and processes, I'm going to give you things you can do about it. And I also want to invite you, the Roselle Center for Healing in Fairfax, coming up the 20th of August. And I promise you that you're going to learn a lot. Dr. Zhang and I, he's a traditional Chinese medical physician and an acupuncturist. We're going to be talking about this, and we're going to show you exactly what takes place and why it comes about and so forth. A lot of it has to do with our environment. A lot of it has to do with diet. A lot of it has to do with your emotional state. But there's also other pieces of the puzzle that you may not have considered. And unfortunately, we're seeing more and more of it today in the post-vaccine era, if you will. And I'll tell you what that means in just a second. And we'll really, put the visors on, if you will, and we'll get through it. But let's distinguish a few things so you really get it. And let's talk about, irritable bowel syndrome. And it's a very common disorder. Now, is it common because we're finger pointing and saying everybody's got this thing, more and more people? See, there's a piece of the puzzle that I get a little bit upset with. And let me tell you what that is. When you come in with a symptom and they can't figure out exactly what the triggering mechanism is, they say, well, it has to be this. So those of you who've been diagnosed with irritable bowel syndrome, did the doctor tell you what was triggering it, what was causing it? But you can have that pain, that bloating, that irritation, that cramping, and then the thing that we call is constipation. And if you do the research now, you're going to see that they say irritable bowel, IBS, and then -C. So what does that mean? That means you have irritable bowel syndrome, but it's constipation. And it's, really? Okay, so that's the only thing that you can say about it? And then they go on and say, okay, how are you going to manage that? Well, they're going to say, increase your fiber intake, avoiding, foods that can trigger or, cause the symptoms, but maybe that will help alleviate some of the symptoms. How do you know that? In our world, in the world of functional medicine, we can muscle test function from, it's called neuromuscle function response testing, to see what you might be sensitive to. So we can have you smell it. We can put a huge 10,000 Gauss magnet, if you will, around it. And the North Pole attracts, the South Pole pushes it. So we can put it into your electrical field and test a muscle. And if the muscle inhibits, weakens, then it tells us that we may have a problem with this, and this may be part of the situation. And the better news is that we can not only identify it, but we can desensitize it and restore normal neurological function. Your physician said, well, lifestyle changes. What does that mean? Well, say, well, drink more water. Well, it can help. Yes, it can. And go out for a walk. That will help as well. Most of you don't get off your derriere. You get up, The only time that you're on your feet is, when you get dressed and you go to the bathroom, you brush your teeth, and you grab something, your cup of coffee, and you go downstairs, get in the car or whatever transportation, you go to the office or wherever you're going to be, and you sit. Or you're working from home and you just sit there. So could you modify some of the lifestyle? Yes. Do you think that there's an important relative to getting things to go, increasing what we call peristalsis? That's the movement of things through the intestinal tract. You bet it does. So take a look at that and see what it is. So it's important that you understand that in most cases of any kind of bowel irritation, irritable bowel syndrome, whether it's a mixed form where you go back and forth from diarrhea to constipation to cramping, then you go into the case of, oh my God, I have colitis. And that's the other tag that doctors like to throw on it is, so what is colitis? Well, it's like irritable bowel, but now you're getting mucus or you're getting blood when you go to the bathroom. It's often very explosive. And there's some other characteristics, but the cramping and the pain pattern and so forth is unfortunately just as bad. And so we want to find out, the distinguishing features between them. It could be allergy reactions. Some of the medications that you're taking, gabapentin, for example, we go to the hospital today with pain. We go see our doctor and we're in pain. We go to, whatever, and we're in pain. Anytime there's pain, they're going to throw a drug, often, not 100% of the time, but called gabapentin. And it's a narcotic, it's addictive. But guess what it does? It slows down peristalsis, meaning the movement of food through the intestinal tract. It slows it down, and sometimes it'll stop it. So if that's the case, is that the contributing mechanism to this irritable bowel pattern? In many cases, the answer is yes. Then you have to take a look at, what's my dietary patterns like? When you eat something that you shouldn't eat, initially what happens, you go to the diarrhea form. And because it irritates your intestinal tract, it's how your body lets you know it's got to get rid of it. It's got to get it out of there now, right now, not yesterday, but now. And if you continue eating it, then what happens is that the neurological end components that stimulate the bowel become blunted. They're not as sensitive. They won't work as well. So you start slowing that down. And what's that called? That's called constipation. And we've said that if you are constipated, that means you just haven't had a bowel movement on a regular basis. What's regular? You should have at least one a day, maybe a couple, 2 or 3. Actually, if you eat something within a short period of time, meaning a full meal, you should have the movement and want to get that done. But so many of us, unfortunately, we don't, right? And so we have to pay attention. Now, so we're going to get into it a little bit right now. I want you to understand it, and I want to invite you, to the Roselle Center in a few weeks, and we're going to go through this whole process. We're going to show you exactly what takes place, but more importantly, we're going to show you how to fix it, and that's the most important piece. So on August the 20th at 6 p.m. at the Roselle Center for Healing, please join us. Dr. Zhang and I will go back and forth, and I promise you, this is a very, very interesting topic. It's kind of a little muddy and a little this and that, but guess what? If you can get rid of the irritable bowel problem, if you can move your bowels, you're going to be surprised just getting those things going. Number one, your potential for other disease processes drops exponentially, and you start feeling better. Your head gets clear. It's kind of crazy. It feels really good and clear. It's like a new day happened. So wouldn't be that great? Wouldn't that be wonderful? So when you have an irritable bowel syndrome due to constipation, and it doesn't have to be plugged up all the time, it can be occasional evacuations. But remember, this needs to be persistent. If you look up the symptoms and so forth, it says 3 months. You have to have persistent things, and then you say, okay, I have this thing called irritable bowel syndrome. And there's occasional constipation, means that you screwed it up, but you get back into the normal movement. But when it's persistent is the problem. So what does that mean? When you have a bowel movement, now I'm going to get a little bit into the nerdy, turdy type of thing. And here's the deal. If they're hard and pellet-like, you're probably constipated. If you have these brick-like things that are very difficult to pass through, you're probably constipated. And if you don't move for a period of time, it's probably a constipation problem. Now, you have to take a look at the medications you're taking. You have to take a look at the travel that you've been going on. You have to take a look at the stress level that you've been under. You have to look at any injury that may have taken place. Do you know that a whiplash injury, you're sitting at the stoplight and somebody hits you from behind or from the front or from the side, that all by itself can cause you to first go into perhaps an irritability, a diarrhea, and then maybe cramping, and then maybe it stops in constipation. Why is that? Why would that occur? It's because you have a long nerve. It's the 10th cranial nerve that comes down and it touches every organ system. And you're going to find, if you pay attention, that there's other symptoms that are associated with it. But one of the things that is very common is that it affects your movement of your stool, and it can stop all kinds of peristalsis, meaning the normal movement through. So when you have a irritable bowel syndrome constipation, if you will, the stools are hard. The bowel movement's incomplete. You might go a little bit, but you're not going completely. Here's the deal. Medically, they're going to tell you fewer than 3 bowel movements a week. Not so much, my friends. You need to be moving that and dumping that garbage out of your system every day. The belly pain is there. It hurts. It cramps. It can double you over. There's just generalized discomfort. There's bloating. You can't get things through. So if you wanted to do a diagnostic on yourself, and when these things happen, what I would suggest that you do is this. Take a look at what you're doing lifestyle and see if you're eating things that are supportive or things that may be soft. And what you do is you go into all of the AI chat boxes. Remember with AI today, when you look at something like ChatGPT or things of that nature, or Pilot, you want to make sure you ask the question correctly. So if you say, what is irritable bowel syndrome? It'll give you a ton of very basic information. But you'll ask, what can cause irritable bowel syndrome constipation? That's one way of going it. How often, in the best of circumstances, should I have a bowel movement? That's another way of doing it. You have to be very specific when you do a search. So when you have a constipation problem, a lot of the doctors out there say, well, it's idiopathic. I say they're an idiot because idiopathic means, we don't know. Well, that's because they haven't really appreciated the body's intimacy of really what takes place, right? So if it's, is it a functional problem? If it's a functional problem, what does it mean? Well, the first place I look is at the nervous system, because that's your computer, that's your mainframe. Brain, spinal cord, 31 pairs of nerves that come off your spine. The nerves divide. One branch goes to organ, another branch goes to muscle. Did you know that when you have constipation and you're cramping and you're irritated, first you're going to get back pain and leg pain and pelvic pain. You're going to hurt. Why? Because reflexively, that's where the nerves go to. But think about it. If it can go into those areas of neurological distribution, then doesn't it make sense that it can go in the opposite direction as well? That if you hurt yourself neurologically, if you've had back pain for a while, wouldn't it make sense that it would slow down the movement and you end up with this ongoing constipation? I've had patients that have come in with low back pain and they forgot to tell me they're constipated. And I usually ask the question, by the way, when I get a little back, I say, constipation, do you have diarrhea? Do you have any mucus problems? Do you have this? Any leg, any toe, any this? And then all of a sudden, I start treating them and we start getting good relationship in that low back, relative to vertebrae. And now they're moving the way they're supposed to and they're stacked the way they're supposed to. And the patient comes in and I say, wow, you really look good. You're moving easy. He said, yeah. And I said, so what else has changed? And then they tell me that they've had this problem with constipation. People don't like to talk about the little things like that. They come in and they kind of hide and they don't say anything. But chronic constipation is a problem across our society, and it's causing tons and tons of disease processes. There's all kinds of drugs out there, and there's a new one that I just heard about, and it's called, if I can pronounce it, it starts with Xifaxan, Xifaxan, I think is. But the problem is, it's got all kinds of side effects, and they're using it for liver problems and swelling. It can cause, when you're taking it in different places, cause brain function problems. But they're saying, yeah, it's great for irritable bowel syndrome. Okay, great. Well, let's take a look at the side effects that may come about as a result of taking that type of medication. And when you see big block letters on the physician side that says, be very careful with this because it can cause all kinds of problems like urinary tract infection, dizziness, and it can increase the presence of swelling, and you can't sleep, and you got fatigue, and you're nauseous, and increases the constipation. It's like, really? Why would we want to even begin to do that? Why would we put that stuff in our body when it's exponentially exacerbating the problem? I don't know about you, but when it comes to making sure that things are done in the natural way, the way your creator, way our good Lord said, your body's supposed to work this way, and we mess it up, step back and take a look at your lifestyle. Step back and take, that your gut, your intestinal tract, if you go to old school stuff, you go to homeopathic, you go to acupuncture, you go to naturopathic medicine, you go to medicine of Ayurvedic in Indian culture and so forth. There's a finger pointing that says that every system in the body has an emotional construct to it, a component. Do you know what it is for the intestinal tract? Your feelings, the ones that we chew on, the ones that we internalize, the ones that we don't speak about. Kind of an interesting thing. So when we harbor and internalize those feelings, we could become, I'll use an old term called anal retentive. Does that fit anybody here? That you just not speaking your truth? You don't want to talk about it? But that gut, that intestinal tract, and the upper portion of your body, the lung, the vocal cords and so forth, work together. You're going to find people who are constipated that they lose their voice. Their voice becomes raspy, and they don't express their emotions very well. It's like speaking the truth. You're going to find that they kind of internalize it and won't let it out. And then, the interesting in my world is that when you finally get the stuff to start moving and start moving through, all of a sudden we start dumping all kinds of other emotional components and pieces of the puzzle as well. Strange, right? But it works. So what can you do? How can you fix this? Well, if it's a neurological problem, you need to see somebody like me. You need to make sure that, and by the way, if you're listening to this and you're out of the area, meaning you're out of the Washington metropolitan area, let me know where you're at. Send me a note. Go to drtomroselle.com and let me know where you live. And I'll recommend 2-3 people that I trust that I would send my own family to, or I would let treat me. And they will probably be able to take good care of you. If you're in this area, come and see us. Look, if you know you've had injury patterns and you're putting up with, and you're taking medications just to kind of, my back hurts when I do this, or, I hurt all over when I do this, and my feet are numb, and you got constipation on top of that, pick up the phone, make an appointment, call, get one of my great doctors at the Roselle Center for Healing to take a look at you. These guys know what they're doing, and do that. But here, what can you do beforehand? 1, drink water. Most of you don't like water. You don't want to drink it. And we need to get at least half of our body weight in ounces in water. Add a little bit of Celtic salt or Baja salt or Himalayan salt to your water. How much salt should you have? It's not going to raise your blood pressure, by the way. How much salt should you get? Probably add about 1/4 teaspoon a day, but you have to make sure you get that much water. Now, that's without adding caffeine. So if you're drinking coffee, if you're drinking heavy, strong black teas, you need to add more water to your system. And you guys say, well, then I have to go to the bathroom. Your body will normalize itself over a period of time But if you want to feel better, you want that bowel movement. So what else can you do? Go for a walk. You've heard me say repetitively, if you're not doing anything else relative to exercise, get your butt up and go for a walk. Go start out 10 minutes out, 10 minutes back. I don't care how fast you move. Just get out. Go do it first thing in the morning. Get a glass of water and go for a walk. 15 minutes out, 15 minutes back. Half hour. That's all you got to do. And then start stretching. You get in a chair and start moving your body around. Little things, bend and twist. And then here's the other thing you do. Massage your intestinal system. Start low on the right-hand side. Begin to dig up all the way through. Come across. This way, go deeper and deeper and deeper, and then go all the way down. Down right, upper right, transverse, down left, and massage it. Help yourself. Change your diet. Take a look at all the junk you're putting in there. Start substituting some good things. Start eating vegetables. You say, what, vegetables? I don't eat vegetables. Well, you better start eating something that's heavier. You can put a little, softer grains in there. Buckwheat is a good choice. Eat something like a sweet potato. Get a lot of other cooked vegetables in your diet. Add a little olive oil to your diet. Just doing things like that will make a huge difference. Now, what else could you do? Well, if you're really in bad shape and you don't mind the cramping, you can do what's called a vitamin C flush. And you start taking, and I'm going to let you look it up. You can go to any of the websites. A vitamin C flush is taking a powdered form of vitamin C, and you take some every 15 minutes until you got to go to the throat, and you evacuate. But you can get yourself up to, some people, 35, 50,000 units of vitamin C before that bowel starts wanting to move. But you got to make sure you're drinking water as well. It will work. Now, with that vitamin C, let's say that we're going to play this game. If you have 50,000 units of vitamin C that makes you want to evacuate, the next day you're going to do 25,000. And if that works, then the next day after that, you're going to do 12. And you're going to stay at that as long as it keeps moving it. You're going to keep flushing. It's called a vitamin C flush. And we do that. We walk our patients through. Usually we change their diet where we're doing it, and we do other things so it begins to solidify. But that will clear the house out. We use that when nothing else seems to work. Magnesium will also help, but you have to use a very specific form of magnesium citrate. And so you take a whole bunch of it before you go to bed. Magnesium has very few side effects that are deleterious. Matter of fact, you're going to have to take the whole bottle before you can get hurt. But what are the side effects of magnesium? You're going to be really tired. It's going to kind of wipe you out, but it passes very quickly. So at nighttime, before you go to bed, you get magnesium citrate, and you take probably somewhere in the neighborhood. Start out with about 500-600 milligrams all at one time, glass of warm water, and go to bed. You may get up in the middle of the night and have to go. All right, so what? At least you're moving your gut. So try that. That makes a big difference in many different types of situations. Combination of vitamin C and magnesium, you're going to move it. It's going to clear house. It's going to work. If that doesn't work, it's telling you've got something much more significant that's going on, and you need to pick up the phone and call us and see what we can do to help you out. But just doing things like that can make a huge, huge difference in your health, how you feel, and so forth. But join us on the 20th of August. Sign up now. Go to drtomroselle.com, register for the class, or go to rosellecare.com. Or you can call the Roselle Center in Fairfax by dialing, put your finger on the button, go 703-698-7117, and ask to make an appointment with one of our great docs, and we'll see what we can do to help turn this craziness around. I promise you, this is reversible. One of the things I haven't mentioned, if you've had any kind of back surgery, that one of the side effects, unfortunately, is constipation. If you've had injections in your spine, unfortunately, one of the side effects is constipation, and gives you that irritable bowel pattern. And they usually have you on habitual medications. And any of those things are not only problematic, but they're also, ones that you just can't get off of easily. We can help you do that. We can reverse the process. We can make a difference. And as I said before, if you're outside the area, let me know. Tell me where you live, and I'll see if there's anybody in those areas that I can trust, and I'll happily refer you. Just remember, your body's a beautifully intimate, integrated machine. It's designed to give you health, the capacity for clarity, the ability to live without trepidation. But we're the ones that generally mess it up. It's not something, in certain cases recently, things have been done to us because of what's taken place over the last 5 years and the vaccine schedules and all that stuff. That's criminal, my opinion. But there's ways around all of this nonsense. Join me on the 20th. Always listen to my radio program on WMAL. It's a subsidiary of Cumulus Radio. It's 105.9 FM in the Washington metropolitan area. Join me. And it's always just before this program. I try to give you the truth twice. Remember, I'm here for you on an ongoing basis for one reason only. I love you all. You have a great Sunday. See you later. Bye.